Hi, everyone. My name is Sébastien Morin, and I work for the Medicines Patent Pool. I will talk today about access to generic long-acting PrEP, the outlooks, and also the progress to date. First of all, I'd like to thank the organizers for the invitation. I don't have any conflict of interest to disclose, but I'd like to thank our funders, Unitate, as well as a number of governments from Switzerland, France, Japan, and Germany, and also thank the entire MPP team in Mumbai and Geneva. The work that MPP, Medicines Patent Pool, does is based on increasing competition earlier than patent expiry, having an effect on prices and increasing uptake, which leads to health impact. We do this by first identifying priorities for in-licensing, and then we approach companies and try to get their agreement for us to work with generic companies to increase competition in low and middle income countries. We then select these generic manufacturers based on a blinded review of applications that they make. And we work with the selected companies for many years, trying to accelerate development and registration. Of course, we also collaborate with partners at the country level and regional and international levels, advocates, governments, UN organizations, and others. We also make a few tools available to support access to medicines efforts. We have a database of patents and licenses covering all LMICs and all patented essential medicines. We also have another database that covers long-acting therapeutics. And we have an access to medicine tracker that includes an interactive map and an interactive table, giving information on access to MPP licensed product at the country level, also over time, and with details on filings, approval, supply, but also possibilities for access. So now I'd like to talk to you about a number of products. First, in the treatment space, I won't focus on this, but just to mention that MPP licensed products have enabled affordable, quality assured access of first-line dolutegravir-based treatments, which are available in more than 100 countries at very low prices. For example, TLD at less than $45 a year now through Global Fund. In terms of prevention, there's a number of products that have been recommended, including oral PrEP, which is fully available as a generic since a few years, and also long-acting injectable cabotegravir, which we have a license for, and I will talk about. But first, let's look at oral PrEP. The map on the left shows the initiations of PrEP over time. The darker the blue, the more initiations. And in Philippines, on the right, you can see the increase over time of PrEP initiations. That's in terms of oral PrEP. Now for cabotegravir for PrEP, as I mentioned, we have a license for that. It includes quality assurance, data exclusivity waivers, mostly royalty-free, except for 10 countries, including Philippines, where there's going to be 5% royalties, as well as limitation of sales in the public market. You can have a look at the license and accompanying documentation on our website. Everything is published online. We have selected 3 manufacturers announced last year working with us. They have already started, and in fact, they have also received technology transfer directly from VIV Healthcare, the originator company developing that product. We think the development will take 2-3 years still, and then they're going to be able to file possibly by the end of 2026, so filing for approval. Meanwhile, the only source of cabotegravir for PrEP will be the originator product from VIV. And of course, we're collaborating with a number of organizations in that space. Here's just a map coming out of LAPAL showing approvals and registration filings. To date, the Philippines has had Cabotegravir for PrEP approved in September last year. So that's the first step that's very important. The territory for access is, as I shown here, there's a direct territory of 90 countries plus indirect territory, so where sales are allowed if there's no patent in force. And so the effective territory, the sum of those two. If you look here, the dark green is where the countries have been included in the license list, and light green is where there's no patents and access may be possible. And Philippines is included in the dark green, as I mentioned, for the public market. Last, I'd like to talk a little bit about the pipeline. Lenacapavir is a drug we have prioritized for PrEP at MPP since 2 years. We're looking at it with a very keen eye because it may allow 6-monthly dosing, so may be quite important moving forward. There's a number of trials ongoing, and you can find information on LAPAL. But of course, the reason why I mentioned that today is because we need to already start collectively planning for access to this product. And so that's the time that governments, advocates, civil society, community, UN agencies, everyone should raise their voice and say, we want access and we want generic access through MPP for this product, because we know this is a working model that will enable affordable access of quality assured products. And so just to conclude, now is the time for some countries to start, but for Philippines to continue expanding access to oral PrEP and to plan for the introduction of Cabele for PrEP in anticipation of its future availability in generic versions in a few years, as I mentioned. So I thank you very much for your attention, and I wish you a wonderful workshop. Thanks very much.